dangerous habits, like driving a car when they do not have the spatial ability to do so. Right hemispheric stroke survivors may also experience left-sided neglect, causing them to ignore objects when they're left. For example, a person with this condition might not eat food on the left side of their plate. Conversely, a stroke in the left hemisphere of the brain can cause paralysis in the right side of the body, or right hemiplegia. Survivors of left hemispheric strokes may develop aphasia, a term used to describe difficulty with speaking or understanding language. Patients who've had a left hemispheric stroke often develop a slow, cautious style of behavior. They may need frequent instruction and biofeedback on the most basic of tasks. Both right and left hemispheric strokes can affect short-term memory, resulting in difficulty learning new information and impaired ability to retain it. A stroke that occurs in the cerebellum affects reflexes and balance. Cerebellar strokes can result in difficulty standing, nausea, dizziness, and even vomiting. The most physically devastating of strokes are those that occur in the brainstem. The brainstem is responsible for all involuntary functions of the body, like blood pressure, heartbeat, and breathing. Damage to this area may require life support. Brainstem strokes can also lead to problems with hearing, talking, and swallowing. No matter the type of stroke, some level of depression is almost always present in survivors. Strokes have a profound, life-altering effect on survivors. Most will need therapy and time to begin the healing process. If you have suffered a stroke, please be sure to remain under a doctor's care.
Or brain attacks are scary, but often preventable. Knowing your risk factors can help you take steps to ensure that a stroke doesn't happen to you.
In America, 1 out of every 16 deaths is caused by a stroke, and up to 80% of those could have been prevented. Anyone can have a stroke. A variety of factors can increase that risk. Some risk factors are uncontrollable, such as your age and gender. After the age of 55, stroke risk doubles for every decade. And additionally, men are more likely than women to suffer from strokes. A family history of stroke means that you have a higher risk of having one yourself. In addition, if you already suffered a stroke or a transient ischemic attack, that is a reversible loss of neurological function, you have a 40% greater risk of having a stroke within 5 years. Another uncontrollable risk factor is race. African Americans are twice as likely as Caucasians to suffer from strokes. Although no one is sure why, higher rates of hypertension, sickle cell anemia, and diabetes are all possible causes. Atrial fibrillation occurs when the 2 upper chambers of the heart beat irregularly, and often rapidly. This allows blood to pool in the heart, leaving clots. This condition increases the risk of stroke 6-fold. These clots can break off and be carried to blood vessels in the brain. Many stroke risk factors, however, are controllable. Having high blood pressure, which is defined as the reading of 140 over 90 or greater, increases stroke risk 4 to 6-fold. High blood pressure makes the heart pump harder. People with high blood pressure often have constricted arteries that make it harder to move blood through the body. This can lead to weakened blood vessels and eventually to hemorrhagic stroke. Cholesterol is a waxy, fat-like substance in the body that is made internally and is also found in the foods we eat. Some cholesterol is necessary for basic body functioning, but when levels rise above 200 milligrams per deciliter, this can lead to a stroke-causing blockage. People who are overweight are also stroke candidates because obesity can lead to hypertension, high cholesterol, and diabetes. Poor lifestyle choices can also increase stroke risk. Because smoking damages blood vessel walls, speeds up the clogging of arteries, and raises blood pressure, smokers have double the risk of stroke. Women who drink more than 1 alcohol beverage a day, and men who consume more than 2, also have increased stroke risk. While the stroke risk factors can seem overwhelming, becoming aware of them and taking steps to get healthier can help reduce your risk of potentially life-threatening stroke. Please see your doctor if you have any of these risk factors for stroke.
Strokes are the 3rd biggest killer in the United States today. Learning the warning signs of a stroke is crucial and could just save a life.
A stroke occurs
Saan na si tatay?
Yan, natutulog pa rin siya eh.
Good morning, tay. Gusto na po pakiramdam nyo?
Dapat ako huminga.
Kukunan ko lang po kayo ng vital sign.
Sumasakit yung dibdib ko.
Teka lang po tayo, ah.
Pero, nahihirapan ako.
Ano po?
Nahihirapan ako huminga.
Kayo po. Teka lang tayo.
Ano to?
Oxygen po para hindi kayo mahirapan huminga.
Sumasakit yung dibdib ko, nurse.
Teka lang po tayo. Teka lang po tayo. Ito pong patch, ilalagay ko para malesen yung sakit. Saka yung pagkakaroon nyo ng muscle spasm. Ito pong gamot. Pain reliever po to. Inumin niyo po to, ha.
Pain reliever.
Ma'am? Meron po ba kayong tubig?
Kuha pa ako, saglit lang.
Good morning po, Tay.
Morning.
Kamusta na po siya?
Medyo okay na po siya.
Okay na po? Oh, pwede na lumabas si Tatay. Wala na kayo talagang iba nararamdaman, as in okay na talaga. Oh, mabuti naman po yun. Mamaya, for billing na siya, pakiayos na lang yung papers niya.
Opo, Doc.
Okay, di po ba uuwi na si Tatay? So, pag uwi niya po, yung po mga drugs niya na dapat i-maintain, pagpatuloy pa rin po. Then, tayo wag masyado magpapagod, ha? Yung mga kinakain nyo na matataba, bawasan muna. Pag smoke, bawasan na yan. At, i-check nyo po lagi yung BP niya. So, pag po mataas yung BP niya, lagi nyo po i-jot down sa notes. Yan po, okay po, Nay. Tapos po, balik na lang po kayo dito next Wednesday for check-up po. Okay po? Sige po. Nurse, thank you po. Sabi ko.
Jenny and a grandma made on an ordinary day. There in the kitchen, Grandma started to sway. Grandma sounded strange when she spoke, and Jenny had to ask, what if my grandma's having a stroke? I think I better act fast. I think I better